Flares. The word flare refers to symptoms you experience when your disease is active, causing tissue to become inflamed and irritated. The most common symptoms are abdominal pain, bloody diarrhea, but can also include weight loss, fatigue, fever, achy joints, skin and mouth sores, and inflamed eyes. Complications are additional symptoms or conditions that you may experience as a result of living with this chronic disease. When you have IBD, you may experience inflammation of other organs, and that includes the eyes, skin or joints, liver or bile ducts. Complications such as anemia, malnutrition, osteoporosis, bowel obstruction, ulcers, fistulas, and anal fissures, and very rarely colon cancer. In children, they can have delayed growth or sexual development. Healing. When you have IBD, the interior layer of tissue lining your intestine, called the mucosa, gets damaged. Mucosal healing is the restoration of healthy mucosa. Mucosal healing is the target of all the treatments that are out there for inflammatory bowel disease. Another challenge of living with IBD is the development of abnormal connections between your intestine and other organs. These are called fistulas, and hopefully proper medication will reduce the likelihood of developing these fistulas. Surgery. Having surgery and spending time in hospital can be worrisome for anyone, so it is better to avoid these events unless absolutely necessary. Surgery is generally accompanied by pain and muscle loss and puts you at risk of a reaction to anesthesia, bleeding, blood clots, heart attacks, and strokes. This is the reason why your healthcare provider will suggest medical treatment in order to reduce your risk of surgery, as the time you spend in hospital for surgery will put you at risk of infection and disrupt personal relationships, work, and school. Adherence. What is adherence? Well, IBD is a chronic disease, and medication should always be taken as prescribed, even when you are feeling well. Again, the goal of treatment is to heal your mucosa. In other words, restore your mucosa to being healthy. And therefore, you should continue your treatments even when you are feeling well. Researchers and doctors will use the term adherence or compliance to describe how well patients follow their treatment plan. This includes taking medications at the proper time, taking all of the medication, refilling prescriptions, and going to appointments for infusion or injections regularly as scheduled.